Why are we promoting drug use? This is how I see it when we pass out needles. It's like, go get high.
Certainly, I think it's important that as your local health department, we're looking at infectious disease transmission. We have real-time data because we are doing that testing in the community, and certainly if there's a critical need or we see an increase in disease transmission, respectfully, we would want a mechanism to, try to allay that spread. But we have to work within the constructs, and at present, there is no prohibition for the distribution of syringes, and it is a practice that does reduce hepatitis C, HIV transmission.
Question about the infectious disease and the needles and not going into Sharps container, which a medical person would put it in a Sharps container. And when they're leaving it on the streets, and we know that you've been testing people with HIV and et cetera, so then these needles are left out on the street, not the streets, in the parks, everywhere. And when little kids pick them up, or parents have to pick them up, or our dogs get stuck with them, what's that transition look for us?
Same.
Law-abiding citizens that choose not to do drugs.
No,
This is
you'll have
insanity.
no disagreement. I mean, they present a risk for those using using IV drugs, but also in the community, and we have to find a balance that does our best to reduce that risk for everybody.
Yeah, I think we
there's
should
no easy answer, unfortunately.
get rid of the drugs and hold people accountable. I'm really sorry.
I did ask, Senator Sullivan is here because she has put in one of the bills.
That we're not medical people. We should not be handing out needles. And the way they're distributed all over, and then disease for our children that are picking them up, and then DPW that has to pick up hundreds and hundreds. We should just eliminate the program completely, and people need to get the help that they need and the guidance, because it's a medical condition. People are suffering. Our city's suffering. Everyone's
Generations are suffering.
Generations.
We're seeing so many kids that are in foster care now and being raised by grandparents because their parents aren't there for them. And it's going to be a generational crisis for our city if we don't figure it out. And I feel like the way that we're doing harm reduction is hurting. And as far as the HIV go, I looked into that Indiana situation a little bit. And often with the needle exchange, there's more to it. And in Indiana, they were giving out condoms as well. They were doing testing. They invested a ton of money into antivirals, so they really took on HIV head on. It wasn't simply a needle exchange that did all of that. It was $15 million they put into a program because they were seeing a rise in HIV that was extraordinary, not since like the 80s. So there was definitely more to that.